Did you know several everyday vegetables found right in your kitchen may work like natural medicine to help manage type 2 diabetes in adults over 60? According to studies from the American Diabetes Association and Harvard Medical School, making small changes to your daily diet can significantly reduce the risk of complications even without medication. In today's video, I'll reveal 5 powerful vegetables that are scientifically proven to improve blood sugar control, and chances are you already have them in your fridge. These aren't exotic or expensive foods. They're simple, often overlooked ingredients that could transform the way seniors manage diabetes. And before we dive in, don't forget to like, share, and subscribe to Elderly Health Tips, because your health or your loved ones might just depend on it. Type 2 diabetes is one of the most serious health issues for those over 60 in the US. As people age, their bodies lose the ability to regulate blood sugar effectively, making blood glucose levels harder to control. Diabetes not only affects overall health, but also leads to serious complications like heart disease, stroke, kidney failure, and even blindness. Older adults, in particular, are more prone to circulation problems, foot infections, and slow-healing wounds, which can become life-threatening if not managed properly. Therefore, controlling diabetes becomes a matter of survival for the elderly. In fact, those with type 2 diabetes face a higher risk of chronic health issues that severely impact their quality of life. That's why finding ways to manage and improve their condition is crucial, especially when natural foods can help reduce these risks. The first food I want to mention today is spinach. But the real magic of spinach goes even deeper than just fiber and magnesium. What makes this leafy green such a powerhouse for seniors is how it supports the entire metabolic system, not just in regulating blood sugar, but also in improving insulin sensitivity, reducing inflammation, and protecting against long-term complications like nerve damage and cardiovascular disease. Let's talk about magnesium a bit more, because it's that important, especially as we age. According to the National Institutes of Health, NIH, nearly 60% of older adults in the US don't meet the daily recommended intake for magnesium. Why does that matter? Magnesium helps cells hear insulin more clearly. When you're low on magnesium, your cells tend to resist insulin's message, leading to what's known as insulin resistance, the driving force behind type 2 diabetes. Now here's the kicker. A 2011 meta-analysis published in Diabetes Care reviewing over 500,000 participants found that for every 100 milligrams increase in daily magnesium intake, the risk of developing type 2 diabetes dropped by 15%. That's huge. And remember, just 1 cup of cooked spinach delivers about 157 milligrams of magnesium, enough to move the needle significantly for many older adults. But it doesn't stop at magnesium. Spinach is also rich in alpha-lipoic acid, a compound that's been shown to improve insulin sensitivity and reduce symptoms of diabetic neuropathy, especially those painful tingles in the feet and hands. In fact, the University of Maryland Medical Center has pointed out that alpha-lipoic acid supplementation found in foods like spinach, broccoli, and organ meats may be beneficial in slowing the progression of nerve damage in diabetic patients. What's more, spinach contains nitrates, not the harmful processed kind, but the naturally occurring type that can help relax blood vessels and lower blood pressure, a key concern for seniors with diabetes. High blood pressure often goes hand in hand with diabetes, and managing both is crucial for protecting the heart, kidneys, and eyes. And let's not overlook the antioxidants, particularly lutein and zeaxanthin. These aren't just eye health buzzwords. They actively reduce oxidative stress, a condition where your body has too many harmful free radicals floating around. For older adults, chronic oxidative stress is linked to everything from cognitive decline to vascular damage, both common complications of diabetes. Spinach helps counteract that naturally. In other words, spinach is doing a whole lot more than just lowering blood sugar after a meal. It's actively helping your body cope with the aging process, keeping inflammation at bay, blood vessels relaxed, insulin functioning, and nutrients delivered to the right places. And here's another reason to keep spinach in your weekly grocery list. It's a real MVP when it comes to eye health and bone strength. Two major concerns as we get older. Spinach is loaded with lutein and zeaxanthin, two powerful antioxidants that naturally gather in the retina and help filter out harmful blue light. That matters, especially for seniors spending more time on digital devices or under artificial lighting. According to the American Optometric Association, these nutrients play a key role in preventing age-related macular degeneration, AMD, a leading cause of vision loss that affects more than 11 million Americans over age 60. What's amazing is that just a few servings of leafy greens each week can help slow its progression. But the benefits don't stop at the eyes. Spinach is also a powerhouse of vitamin K, which often flies under the radar but is essential for bone health. As we age, bones tend to lose density, making them more fragile. Vitamin K helps the body produce osteocalcin, a protein that binds calcium to bones and strengthens them. Several studies, including one from the Framingham Heart Study, have shown that seniors who consume more vitamin K have significantly lower risks of hip fractures. And let's talk energy and circulation. Spinach contains iron and folate, two key nutrients that help your body produce red blood cells. When you're low on these, you might feel tired, dizzy, or weak symptoms. Many older adults write off as just getting old, when in fact it could be mild anemia. Iron helps transport oxygen throughout your body, while folate supports DNA production and heart health. Together, they boost your energy levels and support better circulation, which means more stamina for daily walks, chores, or time with the grandkids. All of this makes spinach not just a blood sugar friendly food, but a total wellness food for aging adults. It protects your vision, supports your bones, boosts your energy, and keeps your heart pumping strong. So whether you're tossing it into your breakfast scramble, blending it into a smoothie, or adding a handful to your soup at lunch, spinach is one of the easiest, smartest choices you can make for healthy aging. Next on the list is broccoli. But what really makes broccoli stand out, especially for folks over 60 managing type 2 diabetes, is how it goes beyond the basics. Sure, it's low in carbs and calories, but the real game changer lies in its sulforaphane content. This naturally occurring compound kicks into gear when broccoli is chopped, chewed, or lightly steamed, triggering a cascade of benefits for the body, especially in regulating blood sugar and reducing inflammation at the cellular level. And let's be real, inflammation is a big deal as we age. Chronic, low-grade inflammation is often at the root of insulin resistance, heart disease, and even cognitive decline. Sulforaphane helps by activating key pathways that lower oxidative stress, turning off some of the bad genes that drive inflammation in the first place. A groundbreaking study published in Science Translational Medicine in 2017, Axelson et al., showed that sulforaphane helps suppress liver glucose production in people with type 2 diabetes. That's major because the liver plays a key role in pumping out excess sugar into the bloodstream, especially in people with poorly managed diabetes. The researchers noted that the effects of sulforaphane were most significant in individuals with obesity and high baseline blood glucose levels, a common profile among older adults. But broccoli's benefits don't stop at sulforaphane. It's also rich in vitamin C, fiber, and chromium, a trace mineral that improves how insulin works in the body. According to the NIH, chromium may help enhance insulin sensitivity, especially in people with glucose intolerance. 1 cup of cooked broccoli gives you about 22 milligrams of chromium, which is more than 60% of the recommended daily intake for seniors. Plus, it's incredibly easy to work into your routine. You can steam it as a side dish, roast it with a drizzle of olive oil, or toss it into a stir fry. For those with chewing difficulties, even broccoli soup or pureed blends work wonders, all without sacrificing its health benefits. So why does all of this really matter for older adults? Because once we hit 60, our bodies don't handle blood sugar the way they used to. It's not just about what we eat, it's about how our systems respond. For starters, insulin resistance naturally creeps up with age, especially if we're less active or carrying extra weight. That means even healthy meals can cause higher blood sugar spikes than they used to. Second, The beta cells in our pancreas, the little guys responsible for producing insulin, start to lose function. They don't respond as quickly, and they don't produce as much insulin as they once did. This decline makes it harder for the body to clear out sugar from the blood after meals. Third, and maybe most overlooked, is the rise of chronic inflammation. Over time, low-grade inflammation builds up, even without obvious symptoms. This background fire in the body messes with everything from insulin signaling to blood vessel function, making blood sugar control even more challenging. Here's where sulforaphane comes in and why it's such a breakthrough for aging bodies. It doesn't just mask the symptoms, it goes deep, working at the cellular level. It turns on genes that fight inflammation, activates antioxidant enzymes that protect our tissues, and helps the liver and muscles become more responsive to insulin. And that means better blood sugar regulation without the crash and burn cycle of many medications. And we're not just talking theory here. According to a 2020 review in the Journal of Functional Foods, people who regularly eat cruciferous vegetables like broccoli have an 18% lower risk of developing type 2 diabetes. That's not just a small dent, it's a meaningful drop, especially for older adults trying to prevent or manage diabetes without increasing their pill count. If you really want to get the most out of broccoli, how you cook it matters a lot. Overcooking can destroy sulforaphane, that powerful compound we just talked about. The sweet spot? Light steaming for 3 to 4 minutes, just enough to make it tender but still bright green. That's when sulforaphane is most available and your broccoli still has a satisfying bite. Want to add a little flavor boost? Drizzle with olive oil, squeeze some fresh lemon juice, or toss in a few slices of garlic. These not only add taste, but also bring in heart-healthy fats and antioxidants, a win-win for your blood vessels and digestion. If chewing raw or steamed veggies is tough on your teeth, no worries. Broccoli is incredibly versatile. You can roast it in the oven until crisp on the edges, saute it with a bit of broth or olive oil, or even blend it into a warm, creamy soup. These softer textures are easier on the mouth, especially for seniors with dental work or sensitive gums, without sacrificing the health benefits. And don't forget, frozen broccoli works too. It's often flash, frozen right after harvest, locking in nutrients. Just be sure not to boil it to mush, keep that short steaming time in mind. The third vegetable we need to know about is carrots. Now let's talk about a veggie that doesn't always get the spotlight it deserves. Carrots. Often dismissed as just a snack or something to throw in a stew, carrots are actually a hidden gem for older adults managing type 2 diabetes, especially when it comes to supporting steady blood sugar and boosting overall health. The bright orange color, that comes from beta-carotene, a powerful antioxidant that your body turns into vitamin A. And while most folks think of vitamin A as just good for your eyes, it's doing so much more behind the scenes. It helps repair cells, support the immune system, and combat oxidative stress, which, as we age, becomes a major contributor to insulin resistance and cardiovascular issues. But what really makes carrots stand out for blood sugar control is their content of soluble fiber. This type of fiber dissolves in water and forms a gel-like substance in your gut, slowing down digestion and the release of sugar into the bloodstream. That means fewer spikes after meals, a big win for older adults whose insulin response may already be slowing down. In fact, a 2008 study published in the American Journal of Clinical Nutrition, Vissers et al., found that adding carrots to the daily diet of adults with type 2 diabetes improved insulin sensitivity by 13 to 15%, reduced LDL cholesterol, and helped stabilize blood sugar levels all in just 10 weeks, with participants eating about 1 cup of carrots a day. Plus, carrots are incredibly versatile. You can eat them raw, roasted, steamed, or even shredded into soups and salads. They hold their nutrients well during cooking, and if chewing is an issue, soft-cooked or pureed carrots are a gentle option that's still packed with benefits. And let's not forget, they're affordable, easy to find, year-round, and naturally sweet without spiking your blood sugar. That natural sweetness can also help curb cravings for processed sugar, making it easier to stick to a diabetes-friendly diet. Another study from Harvard School of Public Health 2013, analyzed dietary patterns of over 200,000 adults and found that those who consumed more orange and yellow vegetables, particularly carrots, had a 23% lower risk of developing type 2 diabetes over 20 years. The protective effects were strongest in older adults and those with higher BMI. So, beyond just blood sugar control, why are carrots such a smart choice for older adults? For starters, let's talk about eye health. As we age, our risk for age-related macular degeneration, AMD, one of the leading causes of vision loss in seniors, goes way up. In fact, over 11 million Americans are living with AMD right now. Carrots are rich in beta-carotene, which the body converts to vitamin A, a key nutrient that protects the retina and helps slow down the progression of this condition. So yes, eating carrots really can help you keep your eyesight sharper longer. Next up, heart health. Carrots are naturally high in potassium, a mineral that helps the body regulate blood pressure by balancing out the effects of sodium. That's especially important for older adults since high blood pressure is a major risk factor for stroke and heart attacks. Combine that with the soluble fiber in carrots, which helps lower LDL, bad cholesterol, and you've got a 1-2 punch for protecting your cardiovascular system. Carrots also pack a powerful punch for your immune system. They contain both vitamin C and a range of plant compounds like polyphenols and flavonoids that help your body fight off infections and bounce back faster from illness. And let's face it, as we get older, we need all the immune support we can get, especially during cold and flu season. Then there's skin and wound healing, another area where carrots shine. The vitamin A from carrots doesn't just help your eyes, it also plays a critical role in keeping your skin hydrated, firm, and healthy. It supports the regeneration of skin cells, reduces dryness and thinning, and helps speed up wound healing, which tends to slow down with age. And perhaps most importantly, carrots may even play a role in cancer prevention. A 2020 review in the journal Nutrients found that a higher intake of carotenoids, especially from carrots, was linked to a lower risk of lung and prostate cancer, two types that become more common with age. That's not just promising, it's empowering. The fourth vegetable is pumpkin. Now, let's talk about pumpkin, not just for your Thanksgiving pie, but for your everyday health. This humble vegetable, often overlooked, is actually a nutrient powerhouse that can do wonders for older adults, especially those managing type 2 diabetes. First off, pumpkin is packed with beta-carotene, a powerful antioxidant that your body converts into vitamin A. Vitamin A plays a crucial role in eye health, but it also helps strengthen the immune system and fight oxidative stress, one of the key contributors to insulin resistance and cardiovascular problems in aging adults. But the real standout here is the soluble fiber in pumpkin. This type of fiber is a game changer for blood sugar regulation. It slows down digestion and helps moderate the absorption of sugar into the bloodstream, preventing those dreaded blood sugar spikes after meals. This means that instead of experiencing energy crashes, you can maintain steady energy levels throughout the day, an important factor for seniors who may already feel tired or sluggish due to fluctuating blood sugar. A 2007 study published in the Journal of Nutritional Biochemistry, Singh et al., found that pumpkin extract can actually help regulate blood sugar and increase glucose uptake by muscle cells, acting much like insulin itself. In tests with diabetic mice, the blood sugar levels dropped by up to 36%, and insulin sensitivity improved significantly, which is key for older adults with weakened pancreatic function. Beyond that, a 2011 review in Nutrition Research Reviews looked at various studies and concluded that pumpkin flesh, seeds, and extracts all help lower fasting blood sugar levels and improve pancreatic function. Some studies even reported a 21% reduction in blood sugar levels when pumpkin was regularly added to the diet. And here's a big one. A large study published in Diabetologia in 2020, following over 300,000 people across the US, Europe, and Asia, showed that the beta-carotene found in pumpkin can reduce the risk of developing type 2 diabetes by 30–40%, particularly in those over the age of 60. This is huge, especially considering that older adults are already at a higher risk for diabetes due to aging, lifestyle factors, and decreased insulin sensitivity. So, why is pumpkin such a great choice for older adults? Let's start with eye health. As we age, we become more susceptible to age-related macular degeneration, AMD, one of the leading causes of vision loss in seniors, affecting over 11 million Americans. That's where beta-carotene comes in. This powerful antioxidant, which the body converts to vitamin A, helps protect the retina and may even slow the progression of AMD. Keeping your vision sharp is crucial as you age, and pumpkin, with its rich beta-carotene content, can be a simple, delicious way to help. Now, let's talk about heart health. Pumpkin is naturally rich in potassium, which plays a vital role in regulating blood pressure by balancing out the negative effects of sodium. It also contains soluble fiber, which is known to reduce LDL cholesterol, helping to keep your arteries clean and reduce the risk of heart disease. For older adults, managing heart health is key to a long, healthy life, and pumpkin is a heart-friendly vegetable to add to your rotation. Pumpkin also boosts your immune system. As we get older, our immune defenses naturally weaken, making us more susceptible to illnesses like the flu, colds, and infections. Vitamin C, vitamin E, and zinc in pumpkin work together to support immune function, helping your body fight off infections and recover faster. So, whether it's flu season or just a time of year when viruses are circulating, pumpkin can give your immune system the extra help it needs to stay strong. When it comes to skin health, pumpkin delivers once again. The antioxidants in pumpkin, particularly vitamin A, play a key role in boosting collagen production, the protein responsible for keeping your skin firm and elastic. This is especially important as we age, and our skin naturally loses its elasticity. Eating pumpkin can help promote faster wound healing, reduce the appearance of dry or thinning skin, and keep your skin looking and feeling healthier overall. The last vegetable is a root that is highly revered in Japan, sweet potato. Why sweet potatoes are a diabetes superfood? 1. Low glycemic index, GI, and slow carbohydrate release. Sweet potatoes are known for their low glycemic index, GI, meaning they release sugar into the bloodstream slowly rather than causing rapid spikes in blood sugar. This is critical for people with diabetes or insulin resistance, as it helps prevent those sugar crashes that leave you feeling tired or irritable. A study published in the American Journal of Clinical Nutrition, Choi et al., 2014, highlighted the fact that sweet potatoes can improve glycemic control, especially when they replace higher GI foods in the diet, like white bread or white potatoes. The study showed that people with type 2 diabetes who ate sweet potatoes saw a 15-20% improvement in post-meal blood sugar control after just 12 weeks. This slow release of glucose helps avoid blood sugar spikes, making sweet potatoes an excellent food for stabilizing blood sugar throughout the day. 2. High fiber content for blood sugar management. Sweet potatoes are an excellent source of soluble fiber, which plays a critical role in blood sugar management. Fiber slows down the digestion of carbohydrates, helping to control the amount of sugar that enters the bloodstream. Soluble fiber also helps reduce cholesterol, which is another risk factor for heart disease, a major concern for people with diabetes. A 2019 study from the University of Sydney found that dietary fiber from foods like sweet potatoes could lower the overall risk of developing type 2 diabetes by 25%. The study followed over 100,000 individuals for more than a decade, and those who had high fiber intake from fruits and vegetables had significantly better blood sugar levels and a lower risk of cardiovascular disease. 3. Rich in beta-carotene and vitamin A. Sweet potatoes are a powerhouse of beta-carotene, which your body converts into vitamin A. This nutrient is essential for maintaining vision health, immune function, and skin health. As we age, our ability to absorb and utilize nutrients decreases, but the vitamin A in sweet potatoes can help slow these age-related declines. In fact, Vitamin A deficiency is linked to impaired immune function and poor vision, which are more common in older adults. A 2018 study published in the Journal of Nutrition revealed that adequate intake of vitamin A significantly reduces the risk of macular degeneration, the leading cause of vision loss in seniors. Vitamin A also helps boost the immune system, which can be weaker in older adults, making them more susceptible to infections. 4. Anti-inflammatory properties. Chronic inflammation is a key factor in both type 2 diabetes and heart disease. Sweet potatoes are rich in antioxidants like anthocyanins and vitamin C, which fight inflammation and protect the body from oxidative stress. By reducing inflammation, sweet potatoes can help alleviate symptoms of conditions such as arthritis, another common problem for older adults. A study published in Frontiers in Nutrition, 2019, found that beta-carotene, along with other antioxidants found in sweet potatoes, help reduce systemic inflammation in people with metabolic syndrome, which is a precursor to type 2 diabetes. The study noted that participants who added more orange and yellow vegetables, like sweet potatoes, to their diet had a 30-40% reduction in inflammatory markers after 6 months. 5. Heart health benefits. People with diabetes are at a higher risk of heart disease, and managing blood pressure and cholesterol levels is crucial. Sweet potatoes are a rich source of potassium, which helps balance sodium in the body, leading to lower blood pressure. Additionally, the fiber in sweet potatoes helps lower LDL cholesterol, the bad cholesterol that contributes to heart disease. According to a study in the Journal of the American College of Nutrition, 2015, increasing potassium intake by eating foods like sweet potatoes can significantly reduce the risk of stroke and heart disease. The study found that people who consumed high potassium diets had a 21% lower risk of stroke and a 14% lower risk of heart disease. Doctor's tip: roast, bake, or steam sweet potatoes to retain the most nutrients. Try mashed sweet potatoes instead of white potatoes, or add them to soups and stews for a creamy texture. Sweet potatoes also work well in smoothies, oatmeal, or even as a healthy snack when baked into fries. So, there you have it. Spinach, broccoli, carrots, pumpkin, and sweet potatoes. 5 simple, affordable vegetables that aren't just tasty, they're powerful tools for managing blood sugar, supporting your heart, protecting your vision, and keeping your body strong as you age. You don't need a complicated diet or expensive supplements sometimes. The biggest difference comes from what's already in your kitchen. If you or someone you love is living with type 2 diabetes or just wants to feel better, move easier, and live longer, now's the time to start. Just one small change at a time. And if this helped you or reminded you of someone who might need it, don't forget to like, share, and subscribe to Elderly Health Tips.